Hello everyone, this is Dr. Cui. So in this video, I'd like to talk about another behavioral question. And tell me about the time when you observed a colleague do something unethical, or what did you do about it? And in order to answer this question, we need to follow the rules. So it really depends on which situation. If it's an emergency situation like your colleague will threaten the patient life, you definitely need to stop him or her first. And if it's non-emergency, you can just go to the next step. You need to you can warn him or her first. If it doesn't work, just report it to the supervisor, and so that's it. Just like your step 2 CK behavioral questions, if you just follow those rules, so it's very easy to answer this question. And at the end of your story, you can add some reflection as well. Like patient safety always comes first, so that's why you will do this and you will do that, something like that. Now I'm going to give you my answer. Okay, Dr. Cui, can you tell me if you have any experience that your colleagues violate the rule, and what will you do? So actually, I personally have no such of those experience, but I heard that one of my colleague that saw our saw his supervisor actually was drunk during his clinical rotation when he was on call, and uh, and uh, and also his supervisor planned to do a procedure to a patient, and then so I would say that if I was my colleague, so I would definitely stop my supervisor first, and next I would so so in order to make sure that uh, he won't cause his procedure won't cause any damage to the patient, and that's the first thing I would do. And next, I would like to talk to him to warn him that he cannot do that, and to make sure that he won't make any mistakes during the on call. And if I'll just let him to go home. Um, and if he just follow my suggestion, that's it. So if he won't accept, if he doesn't accept it, I would report it to our supervisor in order to stop him. So I think it's a pretty standard rules in the hospital. Always make sure that patient safety has won't be threatened by any reasons. So especially by our doctors, won't especially won't by our doctor mistakes. So that's what I can think about how to deal with this situation. Okay, you can see that in my answer, I just typically follow these rules. Um, so based on different situation, and and uh, and make the first action based on different situation. If it's an emergency situation, stop the doctor first, and if it's non-emergency, I would communicate him first, and if he follow my suggestion, that's it. If he doesn't accept it, just report it to the supervisor, and let the supervisor to stop him, and that's it. So I hope you will also have some clue how to answer this question, and good luck.